may konting pagbabago, baka sign na yan na may nangyayari na sa iyo na kailangan ayusin, no? They always think alternative medicines and herbal medicines are cheap. They're more expensive than the standard chemotherapy. Kaya lang syempre na naunahan ka na ng sakit mo, medyo mahirap maghabol. Huwag niyo pababayaan ng mga doktor magdikta sa inyo kasi buhay niyo yan eh.
Good day everyone, I'm Dr. Jing and welcome back to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our St. Luke's experts. In celebration of International Women's Month, we talk about one of the most pressing issues in women's health, cancer care. Today we have Dr. Rubi Li, the esteemed Cancer Institute head of St. Luke's, Quezon City, who will give us more insights about women's cancer care through her medical expertise and compassion. Good afternoon, Dr. Li. Thank you so much for joining us here. Thank you, Doctor, for your invaluable time spent with us. I know you're very, very busy. Our audience have so many questions about cancer. Maybe we can begin with us asking you, ano po ba yung advances in cancer diagnosis, especially in women?
In terms of diagnosis, there's now platforms wherein we do extra testing instead of the usual breast cancer period, no? So ngayon, in breast cancer, it can be divided into several types, basing it on what we call a biomarker. And this can be easily done with just the slides or the tissue that you have. Let's say if you talk about lung cancer, then it's a different platform. You look for what is called targetable mutations or changes in the mutationable or genes that are abnormal, and then see if these abnormal genes will have a medicine that can target it. So the trend right now is called targeted therapy. Or precision medicine. The term is precision medicine. And the way you do it, you do what is called personalized medicine, and personalized medicine is doing extraordinary testing from your tissue, a small bite of tissue, and you do several testing already from it. And from there, you garner so many information that can help you in diagnosing as well, but more so in treatment. Para nababawasan ba yung idea na, ay, chemo, ang daming side effects. Ito, at saka hindi natin alam 100% sure ba tayo na matatarget yan, di ba? So, whereas when you have targeted therapies, then you are able to treat the mutable, the target that you want to hit. Parang dart lang yan. Pag na-dart mo yung bullseye, then you have a greater chance of getting healed. So, yun yung mga bago ngayon. And then the other thing that is very, very new, hindi naman new siya, pero it's a relatively new concept, I think more for the patients than to us, is what we call multidisciplinary care team, no? Wherein, hindi na katulad noon na pag inoperahan ka, i-itcha ka na lang sa ibang doktor, tapos i-itcha ka na naman sa ibang doktor, pa-itcha-itcha na lang, no? So what we do right now is if I have a patient who comes to see me with cancer, then I have my own team. So whoever team you need a surgeon, you need a radiation oncologist, you need a cardiovascular doctor. So you have a team working together for the patient without the patient really having to go to each and every doctor. No? So meron kang some point person, and then you can meet together with the patient and family para isang upuan na lang, isang at saka yung for the patient, I think they will feel more relaxed kesa yung natetense sila tuwing pupunta sila ng ibang doktor, natetense sila. With regards to treatment naman, because of new researches, meron na ngayon ginagawa na kunwari, di ba, let's say chemo, meron na ini-incorporate ngayon na targeted therapy na ipapasok mo ang chemotherapy para mas magiging effective ang release ng chemo sa loob ng cell na mismo.
At mabawasan
din yung side effects. So, meron na mga ganun na ginagawa, no? And then, latest is immunotherapy. Everybody knows immunotherapy is left and right na ngayon, which we use.
Unlike before po, no? We're very lucky nga to be in this era na meron ng immunotherapy.
So, you have immunotherapy. Ano naman immunotherapy? It just increases your immune system. Lay definition is increases your immune system and looks at the cancer cell as something foreign.
And then,
diba? And then tapos kakainin na lang niya yun, no? So, syempre may mga side effects din. Pag alam mo kasi kung anong trabaho ng gamot mo or ano yung ginagawa mo, then you will be able to know ano ang susunod na mangyayari sa iyo na hindi ka natatakot.
Doctor, what about women in general? Are there any unique difficulties that we face as women in terms of cancer?
The most common women cancers that we have is basically here in the Philippines will be breast cancer, and then cervical cancer, and then we're seeing a lot of ovarian cancer, although there are other cancers like pancreatic, colon, no? But commonly breast, ovarian, and cervical cancer. Except for ovarian, because ovarian is we call it a silent tumor.
Quiet lang siya.
Quiet lang siya, tapos nalalaman na lang because may nararamdaman. Pero pwede rin, we can kind of screen ourselves to check ourselves whether we're going to develop this or not, no?
Yes.
So example, cervical CA. Napakasimple lang ang cervical CA. Punta ka lang sa OB-GYN mo, magpa-pap smear ka, makikita kung may abnormal cell na o wala, para habang maaga pa, nagagawa na ng paraan, no? Ang breast cancer, kailangan mo lang naman mammogram and ultrasound. Ang question lang sa breast cancer minsan is yung iba gusto mammogram, ultrasound lang, yung iba mammogram. Pero ang tinatawag namin standard of test talaga for breast cancer is mammography. Kaya lang, kino-combine namin with ultrasound para pagsamahin mo yung dalawa, mas makukuha mo yung accurate details ng isang sakit mo, no? And the rule of thumb is always, we want to catch it early. Kasi if you catch it early, then curable ka. I've been practicing for quite some time. And I've noticed, especially for breast cancer, dati mas marami kami nakikitang stage 4 eh. Ngayon, mas marami kami nakikitang early stage. Tapos, ang maganda lang sa breast cancer ngayon, dati, takot na takot ng mga tao sa chemotherapy because of the stigma of chemo, no? Magsusuka ka, mawawala ka ng buhok, no? Pero I think if you explain it to the patient or naiintindihan ng pasyente kung ano ang nangyayari, bakit siya nalalagasan ng buhok, hanggang kailan lang malalagas ang buhok niya, then I think they're more open about it. Kailangan mas open sila eh. No, at naiintindihan. You cannot make a decision unless it's something that you learn. Knowledge is something that is very, very important when you're treating yourself. Kasi treating yourself means making decision on your own. Kung ano gusto mong mangyari sa buhay mo, ikaw masusunod. Pero dapat, meron naman kaalaman. Hindi yung basta na lang yung parang snap of a finger na, oh sige, bukas gusto ko ganito, bukas gusto ko ganon. Hindi decided yan eh. Hindi decision making yan. No, parang tinatapon mo na lang sa hangin yung buhay mo eh.
It's good nga, Doc, that most patients now, they read about their condition or they listen to podcasts like this. They try to learn more about what they have, no? Para they have educated decision-making as well. Doc, how often should women do their pap smears and how often should they do the breast ultrasound or mammography? Mammography, you said, would be the gold standard. And at what age po usually yun?
Sa breast cancer, you do your mammogram ultrasound at the age of 45, no? 45. Pero kung may history ka, family history ka, it can be lower. Then you can do it earlier. So kung instead na 45, pwede mo gawin at the age of 35. And you do it on a yearly basis.
Yearly, every year.
And then, ang sa mammogram and ultrasound for everybody's information, akala nila, pag nag-mammogram sila this year, next year, magmamammogram sila, okay na hindi mo pansinin yung the year before. Actually, dapat alam mo rin yung the year before and compare it with the new year kasi minsan may konting pagbabago, baka sign na yan na may nangyayari na sa iyo na kailangan ayusin, no? So, yun yung sa mammogram.
You compare it with the last result.
Always with the last.
Compare.
Always. No, and then the other thing with cervical cancer naman, you can do pap smear, and if it's normal, you can do it repeated 3 or 5 years thereafter.
Every 3 to 5 years. Depending on the result, I'm sure. And then, kunwari, may nakita ng abnormality, then mas malamang kailangan nang i-follow through with the OB.
Para habang maaga pa. Alam mo, ang kailangan natin maagapan lahat.
Early diagnosis.
Early diagnosis, early self-awareness is very, very important.
Doc, any lifestyle factors for women developing cancer, either earlier or just because they exist?
Well, basically like cervical cancer, cleanliness, no? And also yung mga history of sexual contact, you have to be aware of those things and just take care of yourself. With regards to breast cancer generally, endometrial cancer, yung endometrial cancer is cancer ng matres, no? Is weight. So, minsan hindi lang yung bigat ng katawan mo, kundi yung proportion ng hips mo to the waist. May mga ganyan no? So, weight is very, very important. You try to maintain a certain weight. Huwag ka tataba kesa sa usual mo. Pwedeng mataba ka, pero hindi ka nadadagdag, okay lang yun. Kung pwede mo bawasan, mas maganda, di ba? Important, the other thing is alcohol intake. Alcohol intake. It's just something that we have to understand that the latest data shows that drinking can also increase your incidence of cancer in general.
Yes, in general.
So in general, it is recommended that you don't take any alcohol. So hindi na rin totoo yung pag red wine, mas less, pag white wine, mas, no? And when you say alcohol, it is alcohol, hindi lang wine. Lalo na yung hard liquor, mas mataas kasi ang alcohol content ng hard liquor. And then of course, smoking is also something that we are aware of.
Lahat yata ng cancers associated ang paninigarilyo.
Yes.
So Doc, you're the head of St. Luke's Cancer Institute in Quezon City. Is there any program or anything that St. Luke's offers our patients with cancer or to help detect or even prevent the progression of cancer?
The mere fact that we have a cancer institute is already something that is good because you want a center, you just want a one-stop shop, no, sana. So in fact, the Cancer Institute, we have already launched the specialty clinics, no? So specialty clinics means that you have a multidisciplinary or different subspecialties getting together to take care of one patient, to give the patient diagnosis, if it's a preference to a second opinion with regard to diagnosis. So multidisciplinary meeting wherein the heads, no, yung mga intelligence nila, specialties, and then they will talk to the patient and they work with the patient. It's not work for the patient, but work with the patient for the patient's treatments and getting better, you know, the
so
cancer.
So, hindi na po siya lipat ng clinic, Doc, nandun na lahat.
Andun na. Tapos, so meron kaming specialty clinics that we launched February 20, no? So we kasama na ang gynecological, kasama na ang breast, kasama na ang lymphoma clinic, bone and soft tissue. So marami kaming colorectal is also included. Hepatobiliary, liver, pancreatic cancer, meron na rin grupo na inumpisahan namin, no? And then syempre yung mga different programs. So, meron tayong mga platforms, yung sinasabi natin personalized medicine. So, marami tayong platforms for that. We were able to work with the different platform owners, no, para at least yung costing din. Siyempre, alam naman natin kahit pa paano, you have to talk about costings, na nakakapag-negotiate kami ng mas mababang cost dun sa platforms na yon. Actually, integral part of diagnosing of cancer, as well as its treatment. And then we have screening. We work with the breast center for screening, mammogram, ultrasound. The institute is a playground, I would call it, of all the subspecialties so that we can work together.
Kung sino yung kailangan ng patient, Doc, mapupuntahan niya doon o makikita niya.
Yes.
That's a very nice area, no? And that's really the moving forward of medicine, personalized medicine, multi-specialty, multidisciplinary, so that it benefits the patient and the family more.
So yun ang importante. Yung gusto kong intindihin ng mga pasyente is, you have to work with us. Wag niyo pababayaan ng mga doktor magdikta sa inyo kasi buhay niyo yan no? So you have to learn to work with your doctors. And it's okay to ask questions. The more questions you ask, the better. Kasi mas nalilinawan mo yung sakit mo, ang journey mo, mas nakakaintindi ka, mas naiintindihan mo kung ano ang dapat mo isagot sa mga tanong na tinatanong sa iyo ng mga doktor. Lalo na sa paggagamot mo.
Doc, I have a question. I'm sure you've seen many patients who chose not to believe or to accept yung mga offered treatment and instead do alternative treatment. Ang dami-dami ngayon sa social media. Nakakalungkot, di ba, Doc, yung they buy these cure-alls. Yung akala nila, pag ininom nila to, gagaling, mawawala yung cancer nila. And then, hindi na sila pupunta sa doctor until late into the game. So,
we usually
what can you say
have
about
that.
that?
So, meron ako mga pasyente na pumupunta sa akin, they talk about alternative treatment. Ang pwede ko lang kasi sabihin is, Ang lahat ng paggagamot na ginagawa namin are based on studies. No? Pinag-aralan yan. May mga clinical trials na tinatawag na parte din kami ng clinical trials. Ibig sabihin, kung may mga bagong gamot na lumalabas at nakita may epekto sa cancer, nilalabas nila at ginagawa nilang pag-aaral sa mas malaking grupo ng pasyente para ma-prove na talagang nag-work siya. Yun ang sa clinical trials, no? Kaya pinag-aaralan lahat yan sa mga ginagawa namin. Kaya pwede namin sabihin na out of how many patients, ilan ang gaganda, ilang percentage, 40 to 60% ang gagaling, magre-respond, hindi magre-respond. May ganun yun, no? Ang problema lang namin sa alternative and herbal medicine is wala tayong background, wala tayong pag-aaral na ginawa.
Yes.
Ang meron silang tinatawag is anecdotal data. Ano ang anecdotal data? Ang anecdotal data is, meron akong pasyente na ganyan, ginamot ko, gumaling.
Or may kakilala ko, may kapitbahay ako, uminom ng ganito, nawala yung breast cancer niya.
Ganun, no?
Anecdotal.
So, ang question I think more is, do we allow it? Ako kasi, I tell them, there are no data for that, no? Therefore, I cannot really recommend it. But if gusto mo, okay lang sa akin, kasi hindi ko naman kayo pwede diktahan eh. No? Basta naiintindihan nyo lang. Tapos kung gusto nyo bumalik kayo pag hindi na kayo masaya. Kaya lang syempre na naunahan ka na ng sakit mo, medyo mahirap maghabol. The other thing that they always think, alternative medicines and herbal medicines are cheap. Let me tell you, sometimes they're more expensive than the standard chemotherapy. And because of that, hindi na rin nagagawa yung mga tests. In fact, we have a lot of patients na coming to us na nakapag-alternative medicine na limit na yung finances and they come to us and asking for help, not only with the treatment but also financially. So tinutulungan namin maghanap kung saan pwede maghanap ng pagkukunan ng pagkagamot.
Naubos na
Naubos na
yung
kasi.
pera nila kung saan-saan yung mga pinapaniwalaan, no? Sa social media.
Early detection, early cure. Do not be afraid. Huwag kayo matatakot sa sinasabing cancer is a death sentence. Hindi na uso yun. Lumang-lumang tagline na yun, no? So, nagagamot naman ang cancer. Kaya lang, mas maganda kung maaga natin makukuha. Always, always be knowledgeable. Kailangan alam nyo kung ano ang sakit nyo para alam nyo kung paano nyo tutulungan ang sarili nyo.